Hello everyone, welcome to Rainbow TV. Today we have Dr. Sailesh Kumar, a vascular specialist. Let us get information regarding prostate problem which we see in elderly males. Let us talk to him. Hello sir.
Hello.
Hi.
Hi.
So as we discussed, prostate is a problem in elderly males and which is complicated to treat elder persons. So how it should be treated and what are the methods in treating?
See, prostate, we know it's a lemon size gland just under the urine bag, that is urinary bladder, and it is there in every male. But as the age increases, they become elder, like 60s, 70s. This gland increases significantly, and because it is surrounding the urine pipe, so it will be, when it is increases in certain size, it presses the urinary that tract, and the patient will experience different symptoms like urine obstruction, or frequency of urination increases, or they're not able to pass the urine or initiate the urine, and the urine stream is also not there. The urine just falls at their feet. And because of the urine retention, they have the urinary tract infection because they are not able to empty their bladder, so they develop recurrent urinary tract infections also.
Okay.
So they experience the different symptoms. Not everyone will have these prostate symptoms. They can have the enlargement but may not be having, because some patients can have mild enlargement of prostate,
Okay.
some can have moderate, and some can have severe. So we categorize them into three categories, and we usually identify them by history of the patient and clinical examination, and a simple test like ultrasound to see the prostate size and measure into the grams how much it is enlarged. So most of the times it is diagnosed with these three tests. Very rarely we require MRI to identify if there is suspicious of any cancer in that. But this is a benign enlargement of prostate. Benign means with age, just simple enlargement of the gland. There is no cancer within it. But if you have, sometimes because these are elder patients, and even the prostate cancer also develops in these patients, so if there is high suspicion, then we need to have the prostate specific antigen MRI test, and if there is any suspicious nodule within that gland, then we need to have the prostate biopsy to confirm that. But benign prostate enlargement is a very common problem. Almost 70 to 80% of the elder males, they are affected with this. They may not experience the symptoms, but the gland enlargement is there.
So elderly people have many other several complications also, no, sir, like diabetes, high blood pressure and all. So how do you treat them?
So see, traditional wise, we know that mild, depending upon the grade, like mild, we treat them with medications, change in lifestyle, and drinking water, trying to avoid drinking water at the night before going to bed. All those things we'll tell them. And these medications in the early stage, they work well, but these medications sometimes some patients, they experience a lot of symptoms of side effects also. So medications doesn't suit everyone, but definitely in the grade 2 and 3, they require treatment. And from the olden days, traditional wise, we are doing surgeries for the prostate. Even the new surgeries like urolift, laser treatment, all have come, but these are all high risk procedures, and they are associated with a lot of complications like bleeding, and the patient has to be kept on Foley's catheter, and there are a lot of, even of the treatment, they experience burning pain while passing the urine and all. And as you said, these elderly patients, most of the times they have diabetes, hypertension, thyroids, something related to the heart, heart stroke, heart stenting already done, or brain strokes and all. These are high risk patients. So these surgeries, major surgeries in these high risk patients are more becomes like sometimes very complicated and high risk procedures. So some of the patients are not even suitable for the surgeries because of their high risk, and anesthesia is also risky in them. So most of the doctors, sometimes if they are high risk patient, they are try to avoid this patient and try to put them on the medications. So these patients continue to suffer like that only. So, but in our hospital, we have prostate embolization. This is a completely non-surgical treatment. There are no cuts, no sutures, no blood loss through the through the hand or leg blood vessel artery, we go till the prostate, we block off the blood supply of the prostate, and any organ in our body without blood supply, it will shrink. So similarly, that technology is applied here. We cut off the blood supply to the prostate only, and prostate over a period of time it shrinks, and once it shrinks, the pressure on the urine pipe get relieved, and the patient will have significant relief of symptoms.
Okay.
A lot of patients, they have doubt when you cut out the blood supply, the prostate completely, it becomes a gangrene or black. No, we cut off the major blood supply. There is normal blood supply from the adjacent organs, and the prostate, because of the 80% of the blood supply is cut off, it will shrink. It will not completely die or become gangrenous and all. So, this is a completely natural kind of thing, because you are just cutting the blood supply. You are not giving or doing any surgery here.
Right.
Once the blood supply, the prostate will shrink naturally on its own. So there are no side effects associated with this very safe procedure, no cut, no sutures, and more important, it can be done even in these high risk patients where the other surgeries are contraindicated, where anesthesia is contraindicated patient. I have done the treatment in a patient who has ejection fraction, very low ejection fraction, means the heart pumping capacity was very low, and he was denied of surgery because of the risk associated with the surgery as well as anesthesia. So he was suffering continuously with this prostate. He was walking with this urinary Foley's catheter with the urine bag in his hand. You can imagine how the life will be miserable. He was ready to spend whatever the amount he want to get rid of that urine bag and all. We have treated that high risk patient because this procedure can be done even in those patients, and he's completely relieved from the prostate symptoms, and now he's free from that urine bag.
Are there any age limits for this treatment?
No, there are no age limits for prostate. If the patient, even we can do high risk, and even at the 90s and 100-year age, we can do this procedure. So that is the advantage of this procedure.
Like, are there any chances for reoccurrence?
Very rare. The prostate embolization has success rate of 90 to 95%, but it should be done by the expert and trained intervention radiologists only. So the results can vary if the doctor is not experienced or the treatment is not done properly. If you are not taken care or cut off the blood supply significantly, otherwise the prostate gland will continue to draw the blood and it will increase in size. So it is very important to get it done at an experienced hand and treat it completely.
Okay, like what are the precautions to be taken to avoid reoccurrence?
So see, once if the procedure is done meticulously and completely, then patient don't have to do anything.
Okay.
That prostate will shrink automatically, naturally over a period of time. So you need not to worry about that, and there are no specific precautions about that. After that, patient will slowly experience improvement in symptoms, because once you cut off blood vessel, it doesn't shrink overnight. It will shrink over a period of time, and the patient will experience improvement in symptoms. As the time passes, he will experience more benefits. So that's the thing. So after whatever the symptom relieved in 3 months, it will be more in 6 months. So as time passes, patient will be more happy.
Okay. So thank you, sir. Thank you for giving your time.
Thank you.